Is surgery the only way to fix a bunion? That's the question we get posed at our clinic probably once or twice a week. I'm William Quang, founder of the Adelaide Podiatry Centres. For over 15 years, we've treated over 10,000 patients. And as I said, this question does get posed quite regularly. Now, out of the 15 years, we've probably only had about a dozen patients that have actually gone through and actually had the surgery. Unfortunately for those dozen or so patients, half of them actually said that they really quite regretted actually having it, mainly because it's just so really painful. If you actually think about the bunion surgery, it's actually a very big procedure. It involves opening up the foot, okay, cutting a bone, okay, drilling a bone, tightening and loosening of ligaments. Okay, so it's a really traumatic experience for the foot. Most of our patients on average say it's about 3 to 6 months before the actual foot is pain-free again. And they've only got one foot, so they're usually getting around in a crutch or something similar to that. And also there's the cost. It usually costs between $5,000 to $15,000, so that must be taken into account as well. Saying that, bunion surgery definitely does have a place. We've seen some very good results in the other half. But we must bear in mind that this type of surgery being so significant should always be treated as the last resort. Mainly because it's just irreversible. Once it's done, it's done. And that's why with those patients that said that they regretted it, one, it was also the pain, but there were also after effects. You know, their foot wasn't quite the same. They may have, the surgeon may have nicked a nerve or not quite aligned it right. So that it is irreversible. Once it's done, it's done. The key to actually treating a bunion is actually catching it before the surgical phase. If we can do this, okay, we can do one of two things. Firstly, we can make your foot pain-free, okay? When you walk and when you exercise, it won't hurt, okay? You can do what you want without any sort of restriction. The second thing is the lump itself. We can retard it to the point where it actually doesn't get bigger, okay? That's one of the major concerns. People are very concerned about the way it looks, so we can stop it from getting any bigger. So, if you want to see if you're in that phase, the phase before it requires surgery, I'd strongly suggest you do it as soon as possible, okay? We can do this at our clinic. All you need to do is just go onto our website and you can book online. Alternatively, you can just call us on 8239 1022. Speak to Sue, and we should be able to sort out an appointment to assess that bunion, and hopefully we can catch it before it needs surgery. All right, hope that helps. Hope that answers the question. We'll speak to you soon. Thank you. Bye.